have a seat. I'll be right with you, okay? Let me just get my paperwork in order. Okay. I just have a couple of basic questions to ask you before we start the exam. Can I have your name, please? And your age, your height, and your weight. Have you ever had a cranial exam before? Yes? Okay, good. This one's going to be a little different. I like to do things a little differently. So, okay. Any neurological issues that you're aware of? No? Okay. And how about any allergies? No? Good. Okay. I think those are the basic questions. If I think of anything as we're doing the exam, I'll ask you. Let me just make a couple notes. Okay, perfect. First, I'd like to start by taking your measurements, okay? So, let me get my tape measure. So, measure your eyes. Okay. Nice. Let me just write that down. Okay. And your face. Yep. And then this way. And then a little bit horizontal. Perfect. This will help me if there's any changes when you come for your next appointment. Then we'll know if anything has changed. Okay, and you've already given me your height, so I don't need to measure that. Okay, let me get my gloves on. And these are latex, so you don't have to worry. I know a lot of people have latex injuries, latex allergies. Perfect. Okay. Well, I like to start with the hearing test, because if you can't hear me properly, then the other tests aren't going to work as well, okay? So, let's start. Let me get my things. And I don't think I need anything. Okay. I'm going to be whispering in each ear a series of numbers. You just repeat them back to me, okay? 1, 2, 3, 4, 5, 6, 7, 8, 10. Yes, I skipped the number 9. 1, 3, 4, 5, 6, 7, 8, 9, 10. Yes, that is correct. I skipped the number 2. I'm just testing you to see if you're paying attention. Okay, I'm going to be making some sounds in each ear, and all I want you to say is right or left, okay? Mm-hmm. Mm-hmm. Good. Your hearing is perfect. So that means we can move on. So don't mind me, I'll be taking notes as I do these little tests, okay? Okay, on to the optic nerve test, okay? I'll be covering one eye and wiggling my finger on the other side. And I want you to tell me top, bottom, left, or right, okay? Perfect. Now the other one. Good. Okay. I want to see how fast your pupils move. Just have this little tool. All I want you to do is just look at the tool, and I'll just be observing your pupils, okay? Good. Now, I will need you I will need to grab the pen. I will need you to follow the tip of this blue pen, and just follow along, okay? Perfect. Okay. Now, let me grab my eye chart and I will need you to recite the letters. And I will repeat after you if you've repeated correctly, okay? C S D V O H O H V C K H Z C K O N. Oh, you can't see. N C K H D D H O S Z. This is the tough little section. V R N D O C Z H K S. Good. If you get this one, that's 20/20 vision. O R Z S K. Good. Well, I forgot to ask you if you wore glasses, but I guess you don't need them. You got 20/20 vision. That's really good. Okay. Let's move on. Okay. Now I'm just going to examine your eyes a bit with my flashlight, okay? So just stare straight ahead, and I will be examining your eyes. Okay. Okay, let me look right in there. Yeah. Okay. Okay. Perfect. Okay. Let me just make a couple notes. Okay. Next, the Geminal nerve test. Don't worry, you don't need to know these terms. I just, gotta be professional. So I'll just be throwing out some of these terms at you. This is basically what it means is a touch test. So we're gonna determine the light touch and pain and temperature. Okay, so let me get my tools. Let's start with the light touch test. It's a tongue twister. Okay, so I have this little Q-tip. What I will be doing is touching different parts of your face, and you just let me know when you feel it, okay? Oh, let's start with your forehead. Perfect. And your cheek. And the other cheek. And your chin. Perfect. Okay. I'll be now doing the same thing, but with a sharp object. This is to determine the pain test, okay? And on your forehead. Good. On your cheek. Good. And the other cheek. Yep. And the chin. Good. You're quite sensitive. How are you feeling? Good. Good. Okay. Okay, now we have the facial nerve test. So I'll be asking you to do a couple movements and just follow along as you can, okay? So let's start by raising your eyebrows. Just like so. Good. Now frown. Good. Close both eyes really tight. Good. Show your upper teeth and your lower. Good. And smile. And puff out both cheeks, just like so. Good. Okay, and on with more movements, but this is the accessory nerve test. Okay, I'm gonna get you to shrug your shoulders, just like so, and lower. Good. And look from side to side with your head. Perfect. Okay. Okay, last movement test, the hypoglossal test. Okay, so I'm gonna get you to stick out your tongue, just like so, and then I want you moving it side to side, just like that, okay? Good, good, okay. Okay, for the vagus test, we are going to need a tongue depressor. And just open up wide and repeat after me. Okay. And next say ka, 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 ka. Okay. And next go. Good. Okay. And we're already at the last test. Last test, we're going to do the olfactory nerve test, which basically means your sense of smell, okay? So I have 2 scents that I'm going to get you to smell. This first one is an essential oil. Just smell that. What do you smell? Cranberries? Correct. Okay. And I saved this one for last. You'll know when you see, or when you smell, I guess. Just open it up. And just smell. Ooh, I could smell it from here. It's very strong. What do you smell? Lavender, yes. This is great for headaches. It's great for sleeping. It's good to relax you. So you can end this session nice and relaxed. And that's it. Let me make a couple notes. Okay, looks like you've passed with flying colors. You are perfectly healthy. So I would just recommend coming back once a year. And we'll just retest everything. Make sure that you're not losing any of your senses. Okay, thank you for coming by, and I'll see you next time. Bye.